Hi, my name is Josh. I own a personal training gym, and for the last decade plus, I've spent over 30 hours a week of every week on the floor training members and clients. And the question we're going to answer today is about asymmetry in the body, especially when you're exercising. We're going to talk a little bit about what it is, why you might find it, and what are the simple things you might be able to do to help address it. Asymmetry itself in the body is not a problem. In fact, your body is naturally asymmetrical. And the easiest way to see this is through the placement of your organs. You'll notice, for instance, your heart is on one side of your body, not in the center of your body. And that goes for basically all of your internal organs. On the outside, it does look like you're pretty symmetrical because you have two eyes and two ears and two legs and two arms, and your nose and your mouth are in the center of your face. But your body is naturally a little bit asymmetrical. And this does seem to pop up. We run into this a little bit when we train. Now, what I'm not talking about is strength imbalances. When you first start training, it's not uncommon to find that you have one leg that is stronger than the other or one arm that is stronger than the other. And a lot of times, this is your just dominant side. If you're a righty, your right arm will be stronger than your left, and just because neurologically, you're just better at doing stuff with that side. When we train, if we do enough single leg, single arm stuff, side to side type of stuff, you will build strength on the other side, you'll get better at using the other side, and you will be able to offset that strength balance a little bit. Maybe not perfectly, but pretty close. Asymmetry in the body is a little bit different, and let me explain where we see it the most. So one of the most common places we see it is when we're in a hip hinge type of movement, maybe like a Romanian deadlift or a good morning, and maybe even a single leg deadlift. You might feel the difference side to side. What'll happen is when we're doing especially the bilateral stuff, like a Romanian deadlift, when you go into the hinge pattern, you'll feel, or a person will feel, one hamstring get tight before the other one. This could be a technique thing. You could be shifting to one side or the other. But in a lot of cases, we could probably link it to natural asymmetry in the body. Again, it doesn't mean that there's anything wrong with you. There's nothing wrong with asymmetry in general. But sometimes you'll feel it when you're doing these bilateral movements. Another good example of this is at the shoulder blades. The shoulder blades are more or less the sort of pelvis of the upper body. Now, maybe not, that's not a perfect analogy, but the thing you have to know about your pelvis is that it's not just one bone in the shape of a bowl and your legs come out from it. It's actually multiple bones, and your two iliums on either side can move a little bit independent of each other. Not a ton, but a little bit. And so what this does is it creates a situation where you could theoretically feel something a little bit different on one leg versus the other. The shoulder blades on the upper body are sort of the pelvis of the upper body in the sense that your shoulder blades can move independent of each other. And so what you'll find is one might be or has a habit of being a little more retracted than the other, or one is a little more depressed than the other, one maybe rotates a little bit better. It might not even be something you can see visually. It might just be a couple degrees of motion, but you can feel it when you do stuff. And this has really important implications for training. Now again, asymmetry itself is not a problem. Having a little bit of asymmetry, even if it's a strength imbalance like we talked about earlier, or whether it's a more natural sort of asymmetry, it's something like a pelvis or shoulder blades, that's not a problem when it comes to training. You're probably gonna find that you'll never be 100% neutral. Because your body is naturally asymmetrical, it's going to always pull you back toward that asymmetry in the first place. And so you'll never be able to be 100% neutral. But what we can do is we can get a little bit closer. If we're talking a couple degrees of motion on either side, and we can reduce that asymmetry by a degree or two, then what'll happen is you'll feel a lot more symmetrical, and you'll feel muscles more equivalently when you're doing like a Romanian deadlift, or when you're doing a row and you feel one side a little more than the other, or maybe even a bench press and you feel one side a little more than the other. And a lot of that has to do with, again, the asymmetry that occurs naturally. So that's just a little overview about why asymmetry happens. It's a natural occurrence. It's just how we're built. Fixing asymmetry, like I said, trying to maybe reduce that asymmetry by just a degree or two is simple, and we can do a lot with training itself. Like I mentioned when we talked about fixing strength imbalances, Fixing asymmetry, usually for most people, is going to involve a lot of single arm stuff, whether it's one arm presses, one arm rows, one arm overhead presses, one arm pull downs, single leg stuff. So that's single leg deadlifts. That's things like lunges, Bulgarians, maybe pistol squats or single leg squats. It could also be B stance work, things like a B stance deadlift or a B stance squat. It could also be your lateral work, right? So lateral lunges. You could be doing some sort of rotational lunges. So you have all these different side to side things that we can do with our major extremities, lower body and upper body. And then from there, another thing to consider is that since so much of this asymmetry really comes down to the position that our rib cage and our pelvis are in, one of the best things we can do is build the most symmetrical core that we possibly can. That means not just balancing your core front to back. A lot of folks, especially if you have lower back pain, what will happen is they'll tend to focus a lot on their anterior core, their abdominals. That could be sit-ups, it could be planks, it could be dead bugs, whatever you're using. But there's more to your core than just front to back. There's also lateral, side to side, and rotational. And one of the best ways that you can balance out your core strength is to include more lateral, side to side. That could be things like side planks, or it could be things like suitcase carries, and then your rotational work. And that could be just simple anti-rotation presses, or it could be things like Turkish get-ups. And the important thing to remember here too is that when you're doing single arm and single leg work, for instance, a one arm bench press is going to engage your core at the same time. So effectively, all of the asymmetrical work you do, it will engage you in a mostly full body way. So when you're doing things like lunges, you're doing things like, again, one arm presses, there is some asymmetrical core activation there as well. But if you want to really sort of bring the full picture in, we want to be doing things like rotational stuff, side to side, and then lateral flexion, things like I said, side planks and suitcase carries, in order to better balance our core out. And what that will do is position our rib cage and our pelvis more neutrally, more symmetrically. And then when those things are positioned more symmetrically, our shoulder blades can work more symmetrically. At the same time, when the pelvis is positioned more symmetrically, your femurs, your legs will have an opportunity to be a little more symmetrical as well. And so that's the basics of asymmetry in the body. Whether you're feeling strength imbalances from side to side, or whether you're actually feeling things a little bit differently on each side when you're doing bilateral movements, the best thing we can do in both cases is really to include a lot more single arm, single leg work, and just make sure that we're bringing a full complement of core exercises to our program so that we can create better symmetry between our rib cage and our pelvis and in our torso. And those are the things that we can do to help ourselves and hopefully create a little more symmetry and just better strength overall.